Have you found yourself being more forgetful lately? We often associate memory loss with diseases like Alzheimer's or dementia, but it can happen due to a number of conditions or causes. We met with one family medicine physician to learn more.
Memory loss could easily be defined as suboptimal brain function. Some patients notice it initially with basic recall, having difficulty with names. Maybe it's something like misplacing things that you normally would remember where you put them. Sometimes it's losing your normal routine, forgetting where you parked your car, forgetting certain things that you typically would often remember.
Dr. Copeland says while many experiencing memory loss may think it's Alzheimer's or another form of dementia, there may be something else going on in the brain.
Changes in brain chemistry. Some of the chemicals and some of the neurotransmitters in the brain aren't working correctly. Some of it's due to plaque deposition. Some of it's due to lack of blood flow to the brain.
But there are preventative measures you can take to decrease the risk of severe memory loss. Dr. Copeland says using the acronym NESTS can help.
The first N is nutrition. So basically, good diet is very important when it comes to preventing memory loss. Vegetables, fruits, foods with good fats. Also, avoiding sugar is an important part of memory loss. So some neurologists call Alzheimer's disease type 3 diabetes. It's not a real term exactly, but it kind of gives you the word picture of, hey, high sugar intake, high sugar consumption can actually lead to loss of neuron function in your brain. The E for in NES is exercise. They say aerobic exercise is very important to help blood flow to the frontal lobe in particular. That's where your decision-making process happens. Like you want to be also involved in weight training, muscle gain. They say the more you work with resistance, you actually can build new neurons in your brain. The first S in NESTS is stress reduction. So people who live high-stress lifestyles tend to have increased memory loss. But doing things to eliminate stress will lower your cortisol levels. Cortisol levels that are high can lead to inflammation in your brain. The T in NESTS is time awake and time asleep. So you want to think about how much time am I sleeping? How much time am I resting? Am I getting good, full 8 hours of sleep a night? The T also stands for time awake. So time awake is important, thinking about how you spend your time when you're awake. Social interaction is very important. Is your mind engaged in mental activities? Are you stimulated throughout the day with your work or with your social relationships? Also responsibilities, having things to do, having friendships, having important jobs, having things that mean things to you. The final S is self-care. So all the things that your primary care doctor should be telling you to do. Keep your cholesterol down, keep your blood pressure down.
Dr. Copeland says if you notice differences in repetitive patterns of memory loss within yourself or a loved one, make an appointment with your primary care doctor so they can do a proper evaluation.